You made it to the Go Commando Show with Fred Galvin. On our new mission, we contend with the naked truths of health, leadership, and overcoming adversity. Now it's time to Go Commando.
Okay, I'm here with Sam, and she is going to discuss a little bit about her career path and educational path as a physical therapist. Truth in advertising, she has performed dry needling on myself before, as well as done some other stretching and procedures when I've had knee problems, shoulder problems, and calf problems. And that's kind of why the Broken Down Marine Commando came down here and, at the recommendation of the Kansas City Chiefs, and met Sam at Sport and Spine Kansas City. So, Sam, what originally led you to becoming or having the interest in being a physical therapist?
Sure. In high school, I was one of the lucky few who did not get injured, and that's not the reason I went to physical therapy school. I worked with our athletic trainer at the high school, and I kind of enjoyed traveling with the teams, football, volleyball, basketball, and I realized that I really like helping athletes get back to sports. Athletic training wasn't perfect for me, so I did some research, did some digging, did some shadowing, and I kind of fell in love with physical therapy. From then on, I just kind of trucked right through. I went to Rockhurst University for my undergraduate degree. I got a degree in exercise science administration, so I also minored in business. Okay. From there, I actually stayed at Rockhurst and got my DPT, my Doctorate of Physical Therapy, and my MBA. That was the first kind of dual degree that they had offered, and so I was really, really excited about it. From the shadowing and from high school on, I just fell in love with helping people move. And that's really what it comes down to, is I'm kind of stubborn. Yes. And I found what I loved, and I just went for it. Yes. And I still love it, which is really exciting to go to work every day, and to help people go back to living, go back to doing what they love. It's really cool.
Yes. You mentioned about being stubborn, and you've probably had those patients that had an injury, and you've prescribed a regimen for them to follow so they could get back on the right track and to advance at the proper rate of speed. Have you seen a lot of injuries when people exceed that and really get aggressive with their recovery?
Sometimes. A lot of people, especially in the clinic that I'm in now, are very, very active, and then they get injured, they take a break, and then they want to go right back to it. Yes. Which is exciting for them, but what they need to remember is when you take a break from any activity, your endurance, your power, everything goes down. And so you have to learn how to progress back into it. I've had a patient do a pull-up to a push. I'm not sure what that one is called, I forget. Tore his tricep because he wasn't ready. It's a lot about education. Patients have to know why they need to progress slowly rather than jump right in. Marathoners and triathletes do the same thing. I have a patient who is an ACL marathoner. She injured herself doing something else completely different, but she wanted to get back to running. That's all she wanted to do. And I told her, you gotta take it slow. You have to start from square one. You can't start back up running 10 miles. Your knee's not gonna handle it. So when patients push past, there is that chance for further injury. But when they're educated and they work with their physical therapist to take those steps that are appropriate, they really do well.
Yes. And that's how I found over the years I've had to modify, some of the very aggressive, as well as what they originally taught me in sports as a youth, and as well as in the Marine Corps and then in special operations, that if you don't have a regimen that's provided by a professional where you warm your muscles and connective tissue up, and then you stretch it, and then you get into some progressive routines before you start doing some cutting or heavy power exercises, you're really going to increase your chance of getting injured. So when you have somebody that's looking to begin a new program, how do you assess their level and their goals?
We talk about it a lot. What are you seriously wanting to get out of this? Whether it's a 5K or they want to go from couch to marathon, where are we really? We do movement screenings. We look at restrictions, whether it's hips or ankles or shoulders or backs. What might keep you or what might increase your chance of injury? And then it's all about education. This is a path you could follow to get to where you want to be. If we find something that limits them, a lot of people have hip mobility issues, and I'm not necessarily talking about the hip joint, but the hip complex. Our world, unfortunately, sits at a desk.
Yes.
We sit in the car, we sit on our phones, we sit at the computer, and all we do is sit. And so that takes all of this mobility that we should have, and it just gets rid of it, and everything
Yes.
tightens back up. So really talking patients through dynamic warm-ups, dynamic stretching, movement-based functional activities can get them to where they want to be. So that's really where we start, is quick assessment. What do you look like when you move? What might be a limitation? And where are we realistically wanting to get?
Yes. I know over the years, I kind of went backwards, because what I learned as a youth, playing a variety of sports, and for 10 years as a youth being in martial arts, and then in the Marines, I learned some very good foundations and baselines of, like I just described. I remember in martial arts, both before the Marines and after, the senseis would tell me, we would warm up. We'd spend an hour before we do any karate. And that was just to warm you up to do a lot of stretching in all kinds of areas. And that was back in the days as a child. I was very active. And I just remember while I was in the Marines, the sensei I had stationed in Okinawa, Japan, really was the same way as my sensei here in Kansas, very serious about the stretching. And is that the stretching aspect of this day and age? You mentioned we're very sedentary. How critical is stretching and warming up before you do any exercise?
It's huge, especially as you age. In the clinic, we talk a lot about dynamic movement, and so when we say stretch, we use the word mobilize. So we're mobilizing our tissue, we're mobilizing our joints, preparing them for more movement. So I get this all the time. A gentleman or a woman will come in and say, well, when I was in high school, I didn't have to stretch before I ran. Well, you're 40 now. You might need to do some dynamic stretching, some dynamic warming up, some tissue mobilization using the foam roller, stretching, things like that, and then go run. So you can still do the same activities, you just have to prepare for them.
Yes.
Because if you don't prepare for them, that tissue extensibility, the way our movement or our muscles contract and relax, that changes over time.
Yes.
And so you have to prepare your body for intense movement.
Yes.
So it's huge.
I know, just like this patient you described, I had the same thing. As time got very short and I had a lot of events to prepare for, I started to find out, well, what can I cut? Maybe I don't have to warm up or stretch. I could just go right into it. And that was right at the time when we were starting off the wars in Iraq and Afghanistan. So time became, very critical for me to look at what I could do and get the most out of it.
Mm-hmm.
That's when I started to get seriously injured. So all those years before, when I had just done this injury-free, and I thought, well, now, it seems like this patient had the same mindset that, you can bypass all that, and it's really planning the amount of time that you need to work out. You cannot skip those steps in the long term and be injury-free, and the older you get, the harder it is, I'm sure, to recover from those injuries.
Yeah, and a lot of times, I remind people, stretching isn't something you have to do. It's an exercise you should do. You can't think about stretching and exercising as two different things. They are the same thing. You just do one before the other. You know what I mean? Like your stretching or your mobility technique or exercises or activities should always come before you do any stabilizing or strengthening. Period.
Yes.
That's the rule. That's the way the game is won.
Yes.
So.
And after you've done some strength or power or a sport, how essential is it to do stretching following?
So what I tell patients is a foam roller is a great way to cool down. It moves the tissue, it gets that mobilization, without necessarily warming you back up. So I use a foam roller as a warm-up and a cool down because I think it just allows everything to move, everything to cool down. Walking is a great cool down. You don't have to necessarily go through an entire stretch routine to cool down. You can if it's appropriate for you, but just for everyday activities, walking and foam rolling tend to do pretty well at cool downs from what I've found.
Yes. I'm sure a lot of listeners have seen people in the gym using the foam roller on their legs and back and different parts of their sides. What exactly is that doing, and how? Some people may think that may not be safe if they're doing it on a certain part of their body, but what is your recommendation on how to use a foam roller?
For us, it's all about kind of mobility. So we'll use it for the upper back, for example, and we sit like this all day, whether it's at our desk or on our phone or iPads. The foam roller, if you use it horizontally along the upper back, gives you that opening of the chest. So you lay on it, it opens the chest, you can roll up and down, get some just extra mobility. One of my favorites is to have the foam roller be vertical, so your head and your bottom are supported, and then do a snow angel. Opens up the pecs, opens up the chest, gets the shoulder blades moving, just kind of opens up that whole upper body. It's great for people who sit at a desk all day.
Is there any preference that you would recommend regarding, I've seen some that are just completely smooth and some that are spiked. Does it make any difference at all?
It's personal preference.
Okay.
The spiked ones, we call them rumble rollers. They are intense. They will dig into those muscle bellies like crazy. The smoother ones, there's usually two different options. There's a soft one and a firm one. I prefer the firm one because I think it gives you a little bit more pushback, so you're not just falling into the roller. It moves the tissues appropriately. The softer one can be used if somebody's a little bit more sensitive to touch and they don't like that firmness. But for that kind of like everyday middle ground, that smooth, hard foam roller is your go-to.
Yes. You mentioned walking is a good cool down. Now, for a lot of listeners, they're professionals and they're busy people. They may not have time to go, lift weights or do pull-ups, CrossFit, but they may just be like walking, riding their bike. What are things, if you're kind of using a gentle approach to fitness, if they're just getting on a bike, is it necessary for people to warm up or stretch before they go on a bike or walk or slight jog?
Yes. Yep. And again, it depends on your skill level and your age. Everyone should technically stretch. Some people don't need to yet. So, whether you're going on a bike ride, your bike creates, we call it a sagittal plane motion, so it's just forward motion. You don't get any work in the frontal plane or the transverse plane motion. So getting on the foam roller, moving the muscles in different ways is a great warm-up to doing something that's in one plane. Walking, you don't just have to walk forward. Backwards walking is awesome, especially if you're someone who likes the water. Backwards walking in the water is a great option. Sidestepping, same thing. We're getting into those motions that aren't everyday motions. Because, like I said, we sit in a forward posture, we walk in that sagittal plane, that forward motion. If we can do other things, it's going to open us up different ways.
Yes. And I know here at Sport and Spine Kansas City, you have a wide variety of fellow physical therapists, some that use essential oils and yoga. If you have somebody that comes to you and that you could benefit from some of these, how do you assess and kind of direct in other areas for somebody that has that specialty?
We definitely work as a team. So there's sometimes when I have a complicated patient, for example, and I'm not 100% sure what I'm looking at, what I'm seeing, what I'm dealing with. I'll pull in Drew, for example. He's my senior, he's my mentor. He's the one who's going to say, okay, you see this, you see that, what's different? He's going to kind of guide me to what he can see, so it gets two sets of eyes. We do a lot of refer out, whether it's to a nutrition specialist, to another physician, or even to Kim is an example of one of the ladies who's do the essential oils. We just talk a lot about the whole body. We do referrals to integrated health, that's gut health, so nutrition, cutting out inflammatory foods, things like that. So it's really fun that we do work as a team, and so we pick each other's brains. We're constantly like, I have this patient that they're having this and this problem, and I've tried this. What am I missing? And so we'll kind of come in and we'll talk about what else could help. And I think that's the teamwork part is so cool because you get 5 brains or 6 brains instead of 1.
Yes, that's really awesome. And especially, I think, for parents who have kids, maybe even before they start exercise routines, and they may notice that they're putting on a little excess weight, or they're being sluggish from their diet or their lack of exercise, and coming into a physical therapist's office. I know growing up, it was not something that first came to mind. It's if you were sick or you were injured, you go to a medical doctor. And I think getting something ahead of time, and that's really what you can do, is putting them on a regimen before they get started to safely accomplish those goals and hopefully inspire them.
Yep, so we actually have started that. We have a proactive and so we have a proactive and a performance program that we do. They're cash-based, not from insurance, but the idea of that is to do that prevention, that prehab. So they come in, they work out with us, we work on some limitations, we go through that screening process, and we have like 3 or 4 swimmers who come in, pretty high level, athletes, kids that come in and they do cross training with us because, they get the swimming practice just fine, but they need the other stuff. We have some ice skaters who sometimes come in. And again, we're getting that cross-training, that prehab before injury. And that way when they come in and they have a tweak, they hurt this or they hurt that at practice, we can fix it immediately. And we don't have to wait, a month before they go see their doctor. They get an x-ray and then they get PT. Yes. Kansas has the direct accessibility, which allows patients to come to see a physical therapist day 1. They don't have to have a doctor's referral to see us, which is really, really exciting because we can get the acute patients and we can do something about it and not wait for them to be chronic.
Yes. Speaking about chronic and children that have hopefully learned from this, that's the ideal. And the chronic is a case like myself where for a number of years, 12 years in my case, I was trying to cheat the system and avoid stretching and warming up and just going straight into strength training or combatives where you're applying a lot of pressure on joints such as your shoulder, your wrist, knees, and that's what over the years of being a commando you have problems with, and it's time to recover. And it kind of led me to a friend at the Kansas City Chiefs advising me about a technique of dry needling. And before we get started on some of those, could you tell me a little bit about how you've seen this help your patients?
Sure. I never thought I would put needles in people when I came out of PT school. That wasn't really on my radar. But coming to this clinic and working here, I've seen the success that it has. And that's why I was willing to give it a shot as a therapist, because I was like, not a big needle fan. Now I don't have a problem with them at all. But what's really cool is the needle gets to some place that I can't get to quickly with my hands. When we're talking about trigger points, which are top bands of muscle fiber that come from compensation, overuse, or injury. So when you think about a muscle, it's supposed to contract and relax, right? The top band makes that muscle inefficient, no longer allowing it to contract and relax, causing an issue. And it can refer pain places. So what the needle is able to do, it's able to get into that muscle tissue and actually break up the tissue, change the chemical balance, reset almost. And that allows me as a therapist to retrain it through exercises and stretching. I've seen huge improvements with my patients. I have some marathon runners who tweak their calves. So they come in, they get needled, we go over activities to prevent hopefully whatever is causing it, and then they go back out and they run and they do great. I have a swimmer that I'm treating right now, just a weekend warrior swimmer. She just tweaks her shoulder because she knows she's not breathing on one side, so she's not getting the mid-back rotation, so it's putting more pressure on her shoulder. She gets needled, working on correcting her stroke, and she's good. It's not a miracle cure. It's not going to cure you. It's not going to fix you, but it's going to put you on that path maybe a little bit faster because it is a more aggressive tool. And patients, that first time they get needled, they're a little nervous. There's some anxiety involved because you have a needle and you're about to poke me. But afterwards, what we're looking for is a change in movement or a change in symptoms. So if I needle you and you couldn't raise your arm over your head and then you can afterwards, that's patient buy-in. They get it.
Right.
They see how it works. And that's huge. So we always have a test retest. So that way patients can see we are making a difference. Same thing for headaches. A lot of times we'll create a headache with needling and then it will go away afterwards. The recreation of a symptom means we're doing exactly what we're supposed to. So it's been really fun to see different ways needling can help my patient population.
To all my fellow grunts out there who in your youth felt it was your duty to protect us, I salute you. And thanks to the listeners of the Go Commando Show who labor on the farm, who are sweating on the construction site, putting forth your very best at the office, you are making a difference. Support the Go Commando Show in our pursuit of bringing you the highest quality professionals. Infiltrate the website at gocommandoshow.com, where you can view all of the podcasts and arm your team with incredible deals on health supplements, commando clothing, and equipment. Every time that you get a good deal, it supports the show. What deals? When you purchase anything from the website, Amazon, healthcare supplements, you're covering our six. And to the ladies on the team, when you outfit yourself in the super sexy threads from Naked Zebra, and yes, I'm talking about in fuego, you are firing the sniper shot for our commandos. How else can you support? It's simple. You smash the follow and subscribe buttons on our social media. That is how you support us bringing great guests to talk about serious subjects, not the mainstream media's fake news. So thank you, and until our next show, stay in the attack and go Commando.